For more on China's global efforts to curb the pandemic, I'm joined by Dr. Sandro Galea. He's the co-author of an upcoming book titled Pained, Uncomfortable Conversations about the Public's Health, and he's also the Dean and Professor at the Boston University School of Public Health. Dr. Galea, thanks for joining us. The Chinese ambassador here in Washington has called for more cooperation between Beijing and the U.S. to fight COVID-19. This in an op-ed in the New York Times. Is he right?
I think so. I think if there's anything that this virus has taught us, is that this virus does not respect national boundaries. It's a global pandemic. And of course, infectious diseases always do not respect borders, but we have allowed ourselves to come to think that we can contain infectious diseases in one country versus another. So we've learned that lesson, and I think anything short of more cooperation would not be doing our job.
There's been a report that shows that in the U.S., COVID-19 is disproportionately affecting black and brown Americans. Viruses obviously don't know race. But why is that? For our international audience, if you can help explain how those numbers might come about.
Yeah, a lot of that mirrors socioeconomic differences in the U.S. in that we have historically had very sharp class divides. A lot of that reflects color divides, with black and brown Americans being more likely to have lower socioeconomic position. And when you in lower socioeconomic position, you're more likely to not be able to physically distance, to have jobs that require you to be there, to be in neighborhoods that have not adopted as much physical distancing simply because they cannot. So there are greater risks for transmission that way. And also, the virus, as we know, is likelier to affect people with underlying comorbidities. So when you have poor health in a particular group, in this case marked by socioeconomic position, it is not at all surprising that we're going to have more viral infection in that group as well, which of course deepens health divides.
What has China done to help the U.S. response? And more so, what does it say to you that the governor of New York is fighting quite publicly with the president and has turned to China for help?
I think if the virus teaches us anything, is that these should not be national battles. This is a global battle founded on our shared humanity. It's really a pity that it ever comes to one country pointing fingers at another at any level. And seeing global cooperation is exactly what we should be seeing. I mean, could that be a silver lining from this event, that we emerge from this realizing that disease has no borders?
China, over the years, has invested heavily in Africa, in parts that the U.S. hasn't or has walked away from, perhaps. It's also helping out now in the African continent in ways that the U.S. Under Donald Trump really isn't. Why is it doing that? And in the long term, do you think this will solidify China's role in Africa?
This is not a world where we can build by walling ourselves off. Our world is globalizing whether we like it or not. The future requires interconnection, interdependence, be it between China, the US, Africa, and insofar as we can build a world that assumes interdependence, the better we will all be and the healthier we'll all be. So I take a completely non-partisan, non-nationalistic approach to this. All countries ultimately share the most important quality of all, which is a shared humanity, a shared concern with our health. And we should do that, recognizing that ultimately we are one world.
All right, Dr. Sandro Galea from Boston University School of Public Health, thank you for joining us.
Thank you for having me.